Okay. Hello, everyone. Welcome to tonight's episode of Navigator Nuggets. I am your host, Dr. Nicole Rochester. As you know, I'm a board certified pediatrician, an independent health advocate, and the CEO of Your GPS Doc. Thank you so much for tuning in to another episode of Navigator Nuggets. Please drop in the comments. Let us know that you are here. Just say hello. For those of you catching the replay, thank you very much. And let me know that you're here. Type the word replay in the comments. As you can see, I have two amazing guests with me tonight. Tonight's episode is all about COVID-19 and mental health. Now, those of you that follow me on my Facebook page, you may have seen a poll that I put up last week. So we are now, I think, on week 13 of Navigator Nuggets related to COVID-19. We've been doing this since March 2nd. Every single episode since March 2nd has been all about coronavirus. And admittedly, I was starting to get a little weary and I thought maybe you all were too. So I put a poll up and I said, okay, we're at the 12-week mark. Do you all still want to hear about coronavirus or do you want to talk about something different? And interestingly, it was split right down the middle. 50% of you said, keep talking about coronavirus, and 50% of you said, talk about something else. So I realized that we really haven't addressed a key component of health in general, and certainly our health during this pandemic, and that's our mental wellness, our mental health. So I have two experts here with me today to help us, navigate through how to get our mental health taken care of during a coronavirus pandemic. So I have the amazing Dr. Ericka Goodwin and Dr. Kathleen Young. They are both board certified, get this, child, adolescent, and adult psychiatrists, okay? So they can take care of anybody who is watching this broadcast, and I'm thrilled and honored that they agreed to join me today. So I'm gonna have each of them just share a little bit of information about themselves so you all can get to know them a little better. So we'll start with you, Dr. Ericka.
Oh, well, thank you so much. I'm so excited to be here. So I appreciate the opportunity to come on Navigator Nuggets. So thank you once again for that. I'm Dr. Ericka Goodwin, like if you're good, you win. As she said, I am a board certified child, adolescent, adult psychiatrist, which is kind of cool. I enjoy it. It makes me happy. I'm also an integrative lifestyle coach and I can't even talk today. See, this is what happens on Mondays when you've been off from way too long. You start getting tongue-tied. I'm an Amazon best-selling author. My latest book, which released in February, is Fix Your Fairy Tale, A Woman's Guide to a Great Life, Love, and Legacy. I'm based in Atlanta. I help women who are disgruntled with life and love redefine and reboot their dreams in order to attract more aligned people and opportunities. As I said before, I'm Harvard trained, but I also am a Spelman graduate.
Love it.
So I have a lot of love for Atlanta, and that's where I still live. And I recently launched a telepsychiatry practice.
Excellent. And you all know, those of you who follow me, we have talked all about telemedicine, both related to COVID-19 and beyond. So that is awesome. Thank you, Dr. Ericka. And Dr. Kathleen.
Hi, everyone. Thank you for having me on Navigator Nuggets. I'm so excited to be talking to you guys about mental health. I think it's a topic that doesn't always get its adequate due. So here we are. I am board certified in child, adolescent, and adult psychiatry. I went to medical school at the University of Pennsylvania and then did a residency at Johns Hopkins, and then made my way up to New York to do fellowship in child and adolescent and in forensics at Columbia. And I have kind of parked myself in the New York, New Jersey area ever since. It wasn't in the plan, but it happened. I'm also a certified life coach, and I do some coaching of parents of, I call them emotionally complex children, but really children with psychiatric disorders. And I also like to coach people with psychiatric disorders who are well, but looking for a different answer, a different way to move their lives forward other than, traditional therapy and medication. So that's pretty much what I do. Primarily for psychiatry, I'm primarily in private practice. I see patients in New York City and in Northern New Jersey. So that's me.
Awesome. So you all can see they are well-rounded. I'm really, really excited to talk to both of you today. So, before we get started, I have to acknowledge the elephant in the room, which is, the weight that has been on my heart. I'm sure it's on their hearts and on your hearts as well. And that's, the most recent killing of George Floyd, but just the culmination of events over last week, really for the last month, and particularly over this weekend. And so I do want to acknowledge that. I think it's very fitting that we're talking about mental health today. I know that I have been struggling all weekend, crying and just really feeling a sense of despair. And so I don't want to start this conversation without at least acknowledging that. That is not going to be the focus of our conversation today, but the doctors and I had a brief conversation offline, and what came up is that this is life. Despite pandemics, despite COVID-19, we are still living and we are still in an imperfect society. And so there are going to be other things that we all are going to have to deal with. And so, hopefully the information that they share with you today will help you to not only cope with COVID-19, but all of the other ills of our society and anything else that you're dealing with right now. But I do want to at least acknowledge that. And of course, our hearts go out to the Floyd family and all of the other victims of police brutality and violence. All right, so I wanted to start, I shared with the ladies, and I think I shared with you all as well, that, I don't have a diagnosed mental health condition, but I found myself in the early stages of this pandemic having anxiety. And I didn't even as a physician, I didn't have a label for it. I was having like chest tightness and heaviness and palpitations, and I was thinking of everything else. And honestly, at one point I thought maybe I even had COVID-19, and I'm putting, feelers out in our doctor groups. And I think it wasn't until one of my colleagues was like, could this be anxiety? And I was like, oh. So, and I've heard since then, that was in March, I've heard from so many friends, family members, colleagues, some of you, who have shared just the impact that this pandemic has had. And so I thought I'd like to start by asking each of you to just kind of share a little bit about what you've seen in your practice, or, in terms of in your world of psychiatry, and the impact that COVID-19 has had and is having on our mental health. Either one of you can jump in.
Okay, well, I guess I can. What? So, I work a lot with adolescents and young adults, and some children. I do see some, I don't want to say older adults, because, I'm in that age group. But the things I think the overarching theme here is that people are stressed. And when we're stressed, we see, the emergence of things like anxiety, depression, psychiatric illness. We see that when people are under stress, whether or not they have a pre-existing diagnosis. Sometimes that can exacerbate a pre-existing diagnosis, but sometimes you see it come out, just as like an adjustment to the stress that's currently happening. But I think what I've noticed is this overarching anxiety related to the uncertainty of it all. Like, we don't know when this is going to end. And we've had a lot of unclear communication, and partially because we don't really know anything about this virus. My own doctor said to me, it's like flying the plane and building it at the same time. And that's why every day the message is different about what we're seeing and what to do. So I think that, the uncertainty and inability to plan for anything really that's in the future or involves you leaving your house is really hard on people. Yeah. And we're starting to see the things we take for granted, like that school is going to be open every day, or that there'll be camp in the summer for our children, or that, college happens on a campus, or graduation, prom, all of these things aren't happening anymore. And we've always seen those things as like, just that's what happens. Like everybody goes to school. School is always open. We've never seen anything like this. And I think that has been really challenging for people to get their head around. And there's just been a lot of disappointment. And I think just all the insecurity of it all has been really hard on people.
Yeah, I agree. The uncertainty is really, really difficult. Do you have anything to add, Dr. Erica?
Oh, well, I mean, Dr. Young said it so brilliantly. I don't have a ton to add, but I think the two things that are just huge that you all brought up was the issue of uncertainty. There's also a lot of grief and loss right now.
Yeah.
There's loss and grief related to people that have passed away due to COVID, people that have passed away due to other stuff because life didn't stop because of COVID. And then the loss of all these milestones or things people would typically do, from loss of graduations, proms, people losing their job, having money changes, just lots of losses. And then sometimes people aren't necessarily all equipped to deal with those losses because number one, they didn't expect them. Number two, especially when you start looking at loss due to death, that a lot of the ways people tend to deal with grief, especially if you look at the Black community, everything that does with someone passed away is getting together. So not only is it you may not be able to be with someone at their last moments, especially if they're in the hospital because of all the COVID restrictions, even if they didn't have COVID, is the first thing everyone does is everyone comes over to someone's house.
Yep.
And people bring food and you're over at the house all the time. Then you get to the wake and the funeral, and then you have the repast. And I think people are just struggling to figure out how to have closure when their general mechanisms for closure are significantly interrupted.
Those are really, really good points. Yeah, I primarily work with family caregivers. And, thankfully, I haven't had any clients that have passed away during this pandemic, but several of my clients have had or have, adult aging parents in nursing facilities or in the hospital. And I mean, they're terrified, not only that they're going to die, of course, but then everything you said, then what happens? And the fact that they're not going to be at that bedside, when they take that last breath. They're not going to be able to have a funeral in the way that we're used to having funeral and memorial services. Really, really good points. So you all mentioned, that this is impacting, people who don't have pre-existing conditions as well as those with existing, mental illness. So I'm curious are you all seeing an uptick in, requests for appointments for individuals with underlying depression or anxiety or other mental health conditions? Are they going to the ER or my fear is that people may need care, but they're actually not seeking it right now because they're, afraid of being infected. So what are you all seeing in terms of the impact on individuals with underlying mental illness? I'll start with Dr. Erica this time.
Well, I think one of the huge things and one of the reasons Dr. Young and I are here and one of the reasons you're doing this is you noted one thing that's very important is people have had a difficult time resolving what to do when it comes to seeing the doctor during a time of COVID, because on one hand, people are sheltering in place and they're told stay at home and they're just not sure how to manage it. So one of the reasons we're even here is out of concern that people don't realize that they can still get the help they need, especially if they haven't been in continued communication with their provider, if they already have one, is so that they don't end up in a situation where people are showing up sicker because they waited so long to come because they were afraid to come out. And a lot of people didn't realize the shift that a lot of people switched to telemed, even though it wasn't promoted. And that's what I tell a lot of people is, it may not, your psychiatrist or your therapist may not have been doing telemedicine before. There's a good chance they're at least doing it during COVID, even if it's not on the website or something like that. The first step is always to call. And I think sometimes our field, the resources are kind of muddy. They're kind of confusing. As you do Navigator Nuggets, I'm sure Dr. Young is the same way. We feel like we're triage navigators all the time because it's someone calling all the time because it's so hard to understand how do you decide, do you need a therapist or a psychiatrist, and how do you even find one? and then take it to the next level. If you're Black, I want a Black one. How do I find a Black one? Well, the easiest way to find a Black one is you ask a Black doctor who's Black one. So, I mean, I think part of the reason we're here is because people are confused of how to navigate the system in best of circumstances.
Absolutely.
But then in these circumstances, there's just a lot of confusion.
Yeah. What about you, Dr. Kathleen? Are you seeing or hearing about an increase in individuals, needing help right now?
So I've had mixed. I think the first week that we were really asked to shelter in place, I was incredibly busy in a way that felt uncomfortable, but and then it sort of dropped off. I mean, I have been doing strictly telepsych at this point. All my visits are online or on video. And I have had some new patient visits. I think people waited a little bit because they weren't sure, like, can I see someone I've never seen before over video? I think that's been very confusing. I mean, normally this time of year is like the busiest time for me as a child psychiatrist. I think typically for child psychiatrists in general, the springtime is a really busy time through June. And I haven't received nearly as many calls, but in the last week or two, I've received a bunch, because I think what people are realizing now is this isn't going to change anytime soon. I mean, I still have a few holdouts who are like, well, when you go back to the office, I'll make an appointment. And I say, well, I don't know when that's going to be. So you should probably just make an appointment. So I think that is, so I think that I agree with Dr. Goodwin in the fact that, like, I think people just didn't know that people were still taking, like, doctors were still taking new patients. And I think that people feel, understandably a little reluctant to start a therapeutic relationship with somebody over video.
Yeah.
It can be awkward. I mean, I think that there's, I still have mixed feelings about it myself. And I think there's a lot that gets lost when you're not in the room, but I'm finding that it works pretty well overall, but I can see why someone would wait as long as possible. I have had a few people go to the hospital. I think that has been challenging because, no one really wants to go to the hospital, but, they're still taking inpatients. People still should go if they need to go, I think. But I think the issue is for people who aren't, and this is the problem with mental health in general, is if you're not savvy about how to navigate the system, it's really hard. And this has made it even harder because it's like, what do I do? Who's taking new patients? Who do I call? And it is always this game of, do I need to see a psychiatrist or do I see a therapist? Because I think people don't know, and they don't know what the difference is, and they don't know what they're getting and what they need. And I think that's been a real challenge for people. I would add that I do think there are, like, a lot of people who are creating support groups and other things during this time. I've seen lists, not ads, but people have posted that on, like, my psychiatry listserv groups. So I think there are people who are trying to help, to reduce costs or just to provide support groups for people, because this is a really hard time.
That's good to know. So both of you mentioned, telepsychiatry. I don't know. I'm honestly not sure about this. In terms of essential services, I know, like, elective surgery is now being allowed. Where do we stand with psychiatry practices? Are they opening back up? Are people going to be able now or in the near future to actually have an in-person visit, or do you all? And I know each person is probably going to be different, each practitioner. But do you anticipate that telepsychiatry is really going to be the norm for the foreseeable future?
I think it's here to stay. I feel like COVID caused a significant pivot, and you could have stuck 10 of us in a room and polled, and everyone would have different nuanced views on telemedicine, as far as from psychiatry of, like, is it great? It's okay, but I miss the corners in the room. I can't see what's happening in the waiting room. So especially for child psychiatrists, you get data from what's going on in the corner, who's outside, what's going on in the waiting room when the parents are with the kids. There's just there's an element of that has shifted. But I think from people feeling forced to do it, because you had a lot of people that shifted into telepsychiatry that probably wouldn't have shifted otherwise.
Yes.
That I think people are realizing that it's not the same, but you can still provide quality services that way. And I think there are people that probably wouldn't have dipped a toe into it, or not yet, that all shifted into it. And then with the continued concerns that since we haven't hit a level where COVID is almost extinguished, that people are looking at it from a safety viewpoint as being the psychiatrist or the therapist, their exposure to people and then who they're going home to, along with the fact that since they see multiple people during the day, if they do in-person visits, who they're potentially exposing their patients to.
Sure.
So I think each person is making very individual decisions on when they're going to shift out of tele, and if they're going to shift all the way out, or if they're going to kind of do a mix where maybe they weren't doing a mix before. But I think it's my personal view on it is that it's going to be one of those things where time will tell. But the other thing is, I think patients are getting a taste of the convenience that can be with it if it works for you and you're comfortable connecting that way. Because there's some people that they're not screen people to begin with.
Yes.
So they're not going to necessarily feel that comfortable connecting that way. But for those that are, the comfort of no longer sitting in traffic or having to negotiate, if you have transportation issues, how to get there, dealing with, especially for people that want high levels of privacy, the fact that you're not going to run into anybody other than whoever is wherever you happen to choose to do your appointment. The fact that you can pretty much do it anywhere is that I think there's going to be a demand from people that have switched to it now that hadn't really done it for the convenience.
I personally love telemedicine, and I agree with you. I think it is here to stay. I think if there's one positive thing that has come out of COVID, I think it's the realization and the acceptance of telemedicine, not just by patients, but by doctors. Because I'm sure you have colleagues, and I do too, that, were very reluctant prior to COVID. And then now they're being forced to adopt telemedicine. And I think most people are finding that they're pleasantly surprised. I think doctors and patients alike. And I wonder, I definitely can see that it could be a hindrance in terms of maybe developing that therapeutic relationship. But I also wonder, with unfortunately the stigma that continues to be attached to mental health, will some people maybe be more comfortable, being able to just have a visit in the privacy of their bedroom or in their home, and not physically, going to the mental health clinic, as some people call it. So I don't know, I guess, time will tell, but I think it's definitely an adjunct to what we were all doing before, before COVID. And I think there certainly can be some benefits. I don't know if this is true for psychiatry, but I know some of my colleagues in other specialties have said that they are really enjoying the telemedicine visits and seeing some of the family dynamics. So like Dr. Goodwin, you mentioned seeing what's happening in the corner, but some of my physician colleagues are saying that they're getting new insight into their patients and their home environment and the interactions, between their family members and things like that. So I would imagine that could be beneficial, for telepsychiatry as well. How both of you have, we have referenced just the navigating. Obviously on Navigator Nuggets, we really focus on the system. So you've talked about the difficulties with navigating mental health. You've talked about, when to see a therapist versus when to see a psychiatrist. So maybe can I just have you talk a little bit about, the differences between a therapist versus a psychiatrist, and then, when people should be thinking about one versus the other, or should, if we have that need, should we all have both a therapist and a psychiatrist? So what's the difference?
Well, the biggest difference is the training. So psychiatrists are medical doctors, and so we do medical school, residency, which includes some amount of, internal medicine and, other medical training, just depending on how you do your residency. So that's the biggest difference. And other then there's so many types of therapists at this point that like there are many types of training, whether it be like a PhD psychology training or social work training. I think there's a marriage and family therapy. Am I saying this? I think it's an MFT. I don't want to say it wrong, so I'm not going to say it, but there's lots of different types of therapists out there.
Yeah.
And so it's really just the training is different. Now, in terms of a psychiatrist versus a therapist, I think that as a psychiatrist, we also think about mental illness in a slightly different way. I think we're trained to think about it, as a diagnosis and a differential, and in that way, and triaging in terms of like, does this person need to be admitted to the hospital? Should we send them to the ER? Can they just be an outpatient? Do they need a higher level of care, like a day treatment program or something like that? And so I think we're trained to think about our approach to psychiatric illness in that way. And I don't see that it done in that way as much in other, just with the therapist. So it's just a different approach. And I think that people have this idea that psychiatrists don't do therapy, but there's plenty of psychiatrists who do. And I see a lot of patients every week for therapy. So it's not because I'm a psychiatrist, you can't see me for therapy. So I think that is the notion, but it's not true. I think it can be more challenging to do that because, insurance would like you to see someone who's charges less money. I mean, it's less expensive to go to somebody who doesn't have medical training. This is our dilemma with, all in all areas of medicine, right now, is that there are people who have different levels of training, that's how I'll say it, who are being asked to do the same job, and it's just different. So I think that that's sort of what it is with psychiatry. The bigger issue, especially for child and adolescent, is there are just not enough psychiatrists. Mm-hmm. And that complicates things and makes accessing psychiatric care much more difficult for people because there's just not enough people to treat all of the people who need help. So, and I think that, and I still think, unfortunately, in the African American community, there's still such a stigma around mental illness that people are still not accessing the care that is there, and is like as much as I think that they should be. And I really want to see the day when that changes. I really do, because I think that would do our community a lot of good.
Agree, 100%. You have anything to add to that, Dr. Goodwin?
I think she said all the biggies. The only other thing I'd add is one of the other small differences is if someone needs like psychological testing, and typically that's done by a PhD psychologist. So typically as psychiatrists, we don't do that type of testing. And actually social workers don't either. You typically would have to see a psychologist for that type of testing. Mm-hmm. And the other thing is as Dr. Young was talking about how we typically think of things a little bit differently, is one of the big things is a psychiatrist is trained as a doctor. So we in med school, all of us do the same stuff for the 4 years of med school in general. So we're taught in a way that when we're thinking through when people show up for us, is whether or not there's something physically going on that's kind of mimicking or looking like a mental health issue. Because one of the things is if for instance, it's your thyroid, if someone starts treating you for depression, but it's a thyroid issue, it's not going to get better. Mm-hmm. So one of the places where we shine a lot of ways, but one of the ways we shine is that we can help think through whether or not there's something else going on that's causing this, that's underlying it, that sometimes it's not a primary mental health issue. It's actually something else physically going on that just kind of hides and looks like a mental health issue.
That's a really good point. So do you all feel that everyone should start with a psychiatrist? If they have a concern for a mental health condition, should that be their first start? Or do you feel that a typical primary care doctor would be able to sort through, kind of whether it's a physical versus an emotional or a mental illness?
That's a tough question. Well, I mean, if you went from, and I'm sure Dr. Young can make this sound even prettier than me, is that I think the first entry is the fact that there just aren't enough of us anyway. So if everybody started with psychiatry, half of them probably wouldn't see us,
Good
which
point.
is one of the reasons why the majority of mental health issues are actually treated in primary care. It's not because we don't want to see people, it's just there just aren't quite enough of us. And as we continue to have all these shifts in our society that are pushing people to breaking points, you start seeing the fact that we have these shortages show up even more. It was really big the last couple of recessions, and everyone's anticipating, especially as we come out of COVID and deal with all of this racial injustice, that people are going to continue to have needs, but we have a limited amount of people that can provide the services. Is that if something's really minor, it's almost like, I love seeing the people that don't have a lot going on, but I realize that sometimes somebody else could take care of it. Because what happens for a lot of us, especially, I'm sure Dr. Young will say the same thing when it comes to seeing kids, that we don't get a lot of the children that are just a little bit sad or bounce around a little bit and stuff. We don't get those kids because someone else took care of them.
Or because their parents don't want them to go on medication.
Yes, that too. That too. So I think there are roles for everyone. Doesn't have to enter at us. We don't have to be everyone's entry point. But I think the important thing, and one of the reasons I'm glad that you're having both of us on, is people have a lot of preconceived notions of not only what psychiatrists do, what psychiatrists look like, how psychiatrists relate to people. And to see that we are real people.
Yes, they're real people, y'all.
That have real conversations.
Yes.
That talk in a way you understand, and that there are Black psychiatrists that understand some of the special stressors that are just due to being Black in this country. And that all of us don't believe in giving people a bunch of medicines, because a lot of people, as Dr. Young just referenced, are concerned that if they come to one of us, that means they're going to automatically get medication. And I think it's important for all of us that don't, they're, as in any field, there are people in different camps. That all of us that are not very medication heavy are very vocal about the fact that we're going to see you as the whole person and see what you need. If you don't, I'm very happy to tell you you don't need medication. I'm very happy to take you off of medication if you don't need it. My personal thought is minimal medication for maximum effect. And I can tell Dr. Young is one of those people too, is that there are plenty of us that are like that. And when you meet one of us, just like meeting a therapist or something else, it's like a relationship.
Yeah.
Each person is not the best fit for you. But just, as women, we kiss frogs. But just because you kiss one frog doesn't mean you're not going to still try to find your prince. And this is similar. It's a fit because it is a relationship. You have to be able to feel comfortable being vulnerable with this person, being open and honest about what's going on, and trusting them with your care, and sometimes with some of your biggest secrets that you may not meet the one that's the best fit the first time. Just
That's a really good point. I love the frog and the prince analogy, or princess if you're a man. I love that. I really like that. So I just want to make sure that the audience knows. So you all, we've talked about the Affordable Care Act and things and health insurance on other episodes of Navigator Nuggets, but I do think it's important to reiterate, particularly for those who may be watching for the first time, and welcome if you are a very first time viewer. In fact, let me know in the comments if this is your very, very first time watching Navigator Nuggets. But I want to make sure that you all know that because of the Affordable Care Act, that mental health services must be covered under, a health plan. Now, this is if you actually have a real health insurance plan that is ACA compliant, not the skimpy or skinny plans or some of the things that may not be traditional health insurance. But for those of you who have health insurance through your employer or through your significant other's employer or through the Affordable Care Act or, Medicaid, Medicare, mental health services are covered. I think that's another myth that I hear sometimes, is that people will say, oh, well, I didn't go to the therapist, or I didn't make an appointment because I don't have the money for that. And yet they have health insurance. So I do want to make sure that everyone is aware of that. It doesn't mean it'll be zero cost, whatever your copay or co-insurance is, and you guys know how to figure that out. But on that note, Doctors Goodwin and Young, I guess my question is, for those who don't have health insurance, because, I always worry, and I mean, of course, this is an issue across the board in medicine, but sometimes you feel like the people who need your services the most, maybe those who don't have insurance, the disenfranchised. Are there any services? I mean, I remember when I was an actively practicing pediatrician, as you both mentioned, access is such an issue. And even kids who had, quote unquote, good insurance under their parents, sometimes it would be really difficult for me to find resources for them in the outpatient setting. So for individuals who don't have health insurance at all, are there any mental health resources, or is there anywhere that they can go for free care, for low cost care?
So there are limited resources, but I think that if you're persistent, you could find them. This is a hard question to answer because, we're talking to people who could be anywhere in the country, and I'm most familiar with the resources that are here. I know in New York City, a lot of the residency training programs offer like low cost care to patients. I've sent a lot of people to those programs. They see a resident, but they're supervised by an attending. So they are, and the residents are conscientious. We all know they're young, but they're conscientious. And so they are getting good care. That's one way. A lot of the training programs, in psychoanalytic and some other places do offer sliding scale, low cost care. I think during this time, there are some states who have created hotlines for people who need mental health services.
Mm-hmm.
So I would look into like the state resources, the health department, what they offer. There are clinics at like university hospitals, that will take patients. There might be waiting lists, and it's not ideal or perfect, but I think those are the places to look if you don't have insurance.
Awesome. Anything else, Dr. Erica?
Sure. I'm glad you brought up residency clinics. The other thing is most places have community mental health centers.
Mm-hmm.
They may shift the names depending on what state you're in, because they have a slightly different name in Georgia, but you can literally, because in Georgia, they call them community service boards. But you can type in community mental health center and it'll tell you what's there. And those are typically organizations that are primarily funded by usually local government money, but in grants and those kinds of things. So they typically are created specifically to serve people that have limited resources, limited insurance, either no insurance or Medicaid or something like that.
Okay.
And then the other thing is, I'm not sure if they have it for every state. I know with Georgia, even if you call our crisis line, they'll tell you where the community mental health centers are. Ours, they call it GCAL. It's the Georgia Crisis and Access Line. But most places have one. But most of the time there are community clinics. It's just figuring out where they are. They're typically county based. Mm-hmm. So a lot of times they're tied to a county, partially because of the funding streams.
Awesome. Thank you, ladies. So I know that some of you have been asking questions. We appreciate your questions. So I'm going to share with the two doctors and we'll see if we can get through some of these. So Yvonne, thank you. Yvonne says, when do you seek help during this pandemic, quarantine, and injustice? Are there particular symptoms and/or duration of symptoms when we should really say, okay, now it's time for me to seek help? What do you all think?
I always feel like this is a game.
No, like who's going to say it first?
It's like Hollywood Squares, which is 3 squares.
Okay, well, Doctor, I'll call you all out to make it a little easier. So, Dr. Goodwin, are there particular symptoms or duration when someone should say, okay, now it's time for me to actually seek professional help?
There are the things that are just the tried and true you need help with, like, everyone knows these, as far as if you're having thoughts of hurting yourself or thoughts of hurting anyone else.
Mm-hmm.
Those are very logical. I think the other ones are, number one, if you're just utterly miserable. So to me, one is misery. You just feel like everything sucks. It's just terrible. The next is if you're having prolonged periods where you just can't sleep, or if you realize you just can't get along with everybody. Like you are so irritable that just somebody breathing gets on your nerves. Because a lot of it for what we do, and I'm leaving stuff for Dr. Young, It's
I'll
a lot
give
of
her a different question. Go ahead. You can answer this one.
a lot of it is just around how well you're functioning. So we have one word we use all the time. It's impairment. You all can use it too. And then you're going to look like you're one of us. You'll look super, super smart. Is we look at the level of impairment. So how much does it get in the way of you doing things? And if it's a situation where you feel like you just can't, it's taken every ounce of energy for you to make it through the day, or you can't seem to engage with people you usually engage with, or you need to work, or you need to take care of your kids, and it's all just going to crap because you can't focus, or it's just too much on your plate. If you just feel so overwhelmed you can't take it, then you need to call someone. But I'm comfortable that you and Dr. Young both agree with me that the key is seeking help early, rather than waiting until it's a crisis. And for a lot of people, especially during COVID, but even before COVID, is people seek help when it's a crisis. Kind of like when people have their blood pressure, and their blood pressure is a bit janky, but they don't do anything until they need to go to the ER.
Yeah.
Is that we can do a lot more for you if we catch it early. The next thing is there's no reason for you to be suffering needlessly because you're waiting to get to the point. And I think a lot of people are waiting till they literally can't function at all, and then they want to see somebody.
Yeah.
And especially when you're looking at ways to try to maximize treatments that are medications and look for supportive therapies and those kinds of things, you're going to have the biggest opportunities for those things when it's early versus later. Then you may have to use medication and use those as a complement.
Just like with all of your other health challenges, right? You all, if you wait until it gets to that critical point, it's going to be more difficult to manage, right? Mm-hmm. I appreciate that. I'm going to drop the number to the National Suicide Hotline in the comments so that, if you all are feeling like you want to harm yourselves, or if you know someone who, is really having a difficult time, please share that information with them. It's 1-800-273-8255. Thank you, Dr. Goodwin. So I think we kind of addressed this. Raina, hey, Raina. Raina says, what are the major things you have noticed that people are stressing about? So Dr. Young, I'll give that one to you. I know we've already talked about uncertainty, and we talked about grief and the inability to have that closure. Are there any other themes that you feel are coming up during this pandemic?
I think it's powerlessness, fear, fear. I'm not sure we said this directly, but, fear of losing your job or not having enough money, and really just fear of, people talk a lot about this new normal and like, what is that going to be? And the landscape is changing, businesses are being forced to close, or going out of business. And so I think people are really anxious about what this is going to look like, and will they be able to get back to their life? If they can't, what's it going to look like? So I think those are the big things. So it's fear, powerlessness, uncertainty, disappointment. Those are the things that I'm seeing a lot of. I'm also seeing a lot of adolescents and college students who are staying up really late, sleeping really late. So this sleep phase shift, it's very common. So don't harass your kids about that. It will go back to normal, but they're all up late, and then parents are freaking out about that too. So just all that. And then, what are we going to do? Are we going to have to go back to work? Are our kids going to be home? I just think there's so many things. People are just overwhelmed by that.
Overwhelmed is a good word. Thank you. Let's see. Mike. Hi, Mike. So Mike asked, could you discuss spirituality or the lack thereof and mental health? That's a deep one. That could probably be a whole separate episode. But, I appreciate your question, Mike. Obviously, the three of us are of African-American descent. And, we know in our community, this is a hot topic. A lot of times we'll hear people say, or, ministers and other individuals, even family members, well-meaning family members, oh, just go pray about it, or that's of the devil. And we don't claim depression. So I do think it's a valid point. I know we can't really get into it tonight, but if you all have any, thoughts briefly about that connection, between spirituality and mental health.
Well, I think you brought in the fact that it's a duality, that on one hand, it's been scientifically proven for a lot of people to be a place of strength, especially because it gives people something to live for and increases their feeling of self-worth, value, and purpose. I think the duality is whether or not with each person's spirituality and whatever that spirituality, religious system, or church system is how that system feels about mental health, because we've all interacted with some systems that were very friendly, that people were like, how can we help? How can we make sure people get the mental health help they need? That we have some counseling here, but we just really need to know when it bumps above what we can handle, in like pastoral counseling or something like that, versus some places, just as you said, that are just kind of like mental health doesn't exist. And I think some of it is just reminding people that spirituality ideally should be able to coexist with mental health, because a lot of us there are all these different versions of it, from the biopsychosocial model to the physical, emotional, spiritual health to the dimensions of wellness. But in all of those, there usually is always some type of spirituality component. It's just a matter of how much space it gives for the fact that mental health and mental wellness, it's still, there's still at times are biochemistry issues.
Yeah.
So they're just presenting differently. Even though they look at studies and someone can get therapy and there still can be a biochemical change when they did psychotherapy. So it's a mixed bag.
That's awesome. Do you have anything to add to that, Dr. Young?
I think Dr. Goodwin said all that I would say. Aside from, we don't expect people to pray away other kinds of illnesses. Yeah. And I don't think that this should be different. I mean, I think there are times when life stressors and those kinds of things bring this stuff on, but once it's on, once it's in motion, even if the stress goes away, people can stay depressed or anxious or those kinds of things. And then what? I think, and I think what it ends up doing is creating a lot of shame around not being strong enough, not praying hard enough, not, right, being enough. And we already have enough of that. So I think it's important for people to feel like this is not a weakness. And that they can exist together. They can coexist. You can be religious and spiritual and also get treatment for your mental health.
Love it. Love it. Thanks, ladies. Well, it is 8:49 p.m., at least here on the East Coast. And I don't want to keep you all too long. I appreciate you all hanging in there with us. You all have asked amazing questions. You've been engaged. My guests are awesome, just as I told you they would be. So I want to thank both of you again. And really, I just want to turn it over to you to see if there's anything else that, either something we didn't talk about related to COVID or not, or maybe you just have some strong, tenet or something that you just always feel like everybody should know about mental health. I don't want to sign off without giving you that opportunity. So anything we left out?
I feel like we said a lot. And I just want to reiterate that, this isn't something that you should be afraid to do. seeing a psychiatrist, it shouldn't be scary. It's fine. We're normal people. We're doctors. And also, like, you can find somebody who's not gonna push you past, your comfort level. Well, I shouldn't say that. Who's not gonna unnecessarily push you past your comfort level. And not everybody goes on medication. I'm gonna leave it with that, because I think that is a myth, that everyone who sees a psychiatrist goes on medication. That is not true. And not everybody stays on medication forever, and you shouldn't be afraid of medication. That's what I'm gonna say.
Good one. Good one. Dr. Goodwin?
What I would leave with, especially since we're also talking about COVID, is that even though there is uncertainty with COVID, you are not powerless. So it's remembering and holding on to the fact that there are a lot of things you're still in control of. I think that will give you back that feeling of not feeling like you're spinning dealing with COVID, because we can't control the virus itself, but we can control our behavior. We can control our environment. We can control how we take care of our health. We're in control of those things.
Very true. Excellent closing thoughts. Excellent. Do you want to leave how can people find you, reach you? I don't know if you're taking new patients, if you're taking new coaching clients, but if you are, how can people find you? Dr. Goodwin.
Okay. So you can find me on all social media at Dr. Ericka. You have to spell it all the way out, though. My parents used all the letters. So it's DoctorEricka. They used all the letters, and that's Instagram, Twitter, Facebook, LinkedIn, all that stuff. The other thing is you can find my telepsychiatry practice at goodwintelepsych.com, goodwintelepsych.com, and on there it has the states I'm licensed in. Even though I'm based in Georgia, I can see people other places. And if you have questions, just scroll to the bottom. There's an email and a phone number you can call.
Perfect. Thank you. And Dr. Young?
Okay, so for psychiatry, it's not as easy to find me. Because we're in demand, that's been lower down on my list of things to do, but I think I'm pretty easy to find on Google in that way. For my coaching practice, it's just Kyoung, www.kyoungmdcoaching.com. And that's that, yeah.
Awesome. And I'll make sure to drop those links in the comments for you all. Well, thank you, Dr. Ericka Goodwin, Dr. Kathleen Young. It has been amazing. As always, I always learn a lot as well. So I'm sure that my guests learned a lot. And I just want to thank you all for taking time out of your busy day to sit with us and to pour into us and to, just really share and dispel some of those myths and the stigma around mental health and seeing a psychiatrist. So I hope that this has been helpful for all of you. Please share this video. I think everybody needs to see this. I think that mental health is just really not given the attention that it should in our country in general, and certainly among, the African-American community. So I encourage you to share this video with your friends and family members. And I look forward to seeing you all next week. Since the poll was split 50-50, unless something crazy happens, because you all know the states are opening up now. And so unless there's some huge surge or something that I feel compelled to share with you next week regarding COVID, I'm probably going to have a non-COVID Navigator Nuggets next week for the first time in months. So if you didn't participate in the poll and that's not what you wanted, I'm sorry. But I think I will take just a short break. It doesn't mean I'm not going to talk about COVID ever again, because as we've discussed tonight, it's not going anywhere. But I think I will take a little break and maybe talk about something different next week. So to find out what that is, make sure you come back next Monday night, 8:00 p.m. Eastern Standard Time. And again, thank you, ladies, so much for your time. Thank you for your energy and your enthusiasm. I really, really appreciate it.
Thanks for having us. This was great.
You are welcome. All right, everybody. We will see you next week. Take care. Bye-bye.